Welcome back to the Wellness with Delaney podcast. I am so excited today because we have a really phenomenal chiropractor based out of Arizona. This is Dr. Stephanie Benz, and we are going to talk about all things spinal health, posture, chiropractics from beginning to life to end of life, and even holistic wellness because we always love to cover that on the Wellness with Delaney podcast. Dr. Stephanie Benz, thank you so much for joining me today.
Thank you for having me. I'm super excited to dive in and talk more about this and just educate people about health and wellness in general.
I'm so excited as well. So let's just start like super basic for those who might not know exactly what chiropractic care is and the importance of it. So, what exactly does a chiropractor do?
So it's kind of a loaded question because you're probably going to get a different answer from whoever you talk to because chiropractors, there's lots of different specialties within chiropractic. I'll kind of hone in on what both my husband, Dr. Rossbens, and myself do in our practice. So we're very neurologically based. So we're looking at the brain and the body. How well is it communicating with each other? What do your spinal curves look like, right? Because a lot of times, the big thing that people always talk about is posture, right? Because posture is directly correlated to how your body is functioning. So when we look at those proper posture points too, right? We're looking and say, okay, do you have that neck curve? Do you have that low back curve? And how is your nervous system cooperating with that? So that's kind of like the big gist of it. Most people think, oh, I have neck pain, back pain, headaches. While it's great for that, we're really looking at the whole body as a functional unit versus systemic unit in terms of, hey, I have these symptoms, how do you fix it? It's not necessarily for us just a musculoskeletal approach, it's a full body approach and a nervous system approach, if that kind of answers your question. Again, I could go on this topic forever, but when people think of chiropractic, they think of neck pain, back pain, headaches. How can we resolve it? But again, I want to focus more of it being a systemic thing and that it's a nervous system thing and that we're trying to get that brain and body communication to work optimally.
I love that. And that kind of leads perfectly into my next question. Because I do think a common misconception with chiropractic care is people think the spine only affects the spine. So, what are some of
Correct.
the common systems of the body that you see being negatively impacted by poor posture or poor alignment?
So the big one that I think is circulating right now is hormones is a big one. Um, Cortisol levels, right? So stress, I guess that's probably even a bigger one. Stress. So people are stuck in what's called this fight or flight response, right? So a bear's running after, your heart's accelerating, your pupils dilated, you're sweating, your hands are sweating, your back's sweating, and you don't know how to down regulate. And a lot of people are stuck in this high sympathetic tone environment, and it's leading to a lot of other issues. So, we're seeing more autoimmune issues in kiddos. We're seeing ADD, ADHD. We're seeing skin problems, we're seeing infertility problems. I mean, the list literally goes on because these cortisol levels are not being regulated and people don't know how to go into their parasympathetic or rest and digest state, and it's creating lots of issues metabolically in the body too.
Wow, yeah, that's a lot. And I think so many people don't even realize that they're living in fight or flight because it's become so
Correct.
normalized. What would be some common symptoms that somebody has dysregulated cortisol?
So high cortisol, I mean, it kind of honestly, you can get people with high cortisol or low cortisol. There's actually a lot of variations depending on your age. Again, there's lots of variables for that. So generally speaking, high cortisol, anxiousness, difficulty sleeping, you could have low libido. Um, let's see, not enough energy to even do workouts. You can't do workouts. You see skin changes, your hair is not as full. I mean, it's there's a lot of factors with high cortisol. You can't lose weight. That's a big one for people because I know right now, again, this is a whole nother topic, but a lot of people are on that Ozempic kick, right? How's the quickest way that I can lose weight? And we're not focusing on our actual bodies, like what's working with us, we don't want a quick fix, right? Nothing that's worthwhile is going to be done like that because as soon as you stop doing something, your body is just going to be like, whoa, what was in my system for so long? And again, that's a whole nother rabbit hole. But the big thing for this is, again, those symptomatologies with high cortisol. People can't relax, they're stressed out. You have a short fuse even too, right? With your spouse or your kids. People are like, why do I get so mad at my children? Or why do I, my spouse and I, why are we arguing all the time? And again, it's most people are dealing with high cortisol issues, is what we're seeing over and over again.
Wow, that's so crazy too, because I think so many people, myself included in the past, can think that some of these like emotional outbursts or these relational, like the tension can just be who we are. When a
Yeah,
lot of time there's a literal hormonal imbalance affecting it. And when you can balance those things, suddenly you're like, wait, I'm actually in
correct.
control. Like I actually feel good.
Correct.
It's
Yep.
phenomenal. So if somebody were to come in, let's say I were to come into you as a new patient, I have high cortisol because that's what we're seeing probably more commonly than low cortisol. What,
Right.
aside from adjustments, like what would you recommend that I either add or take away into my home regimen?
So, I mean, it's again kind of a loaded question. I think the big thing is honing in, like, what does your day-to-day life look like? A colleague of mine always likes to call it, like, what does the beginning of your day look like and what does the end of your day look like? Because I'm going to pull it up. Cell phones, right? Cell phones, we have, I don't know, TV. People are always wanting to be stimulated, right? So kind of what does the end of your day and the beginning of your day look like, and what does the middle of your day look like? Are you, when you first thing you wake up, are you looking at your cell phone? Are you looking at your cell phone right before you go to bed? What is your food intake? Are you eating enough protein? I mean, again, I could go on for this. So looking at day-to-day life stuff is going to be really important. Then obviously you're coming into my office for us to evaluate your spine, right? So we're having those conversations. What does your day-to-day life work look like? Are you sitting most of the day? Are you standing most of the day? What type of shoes do you wear if you're standing most of the day? The type of work, what does your work setup look like? So I think that's kind of a big thing for me too, is looking at that, are you active? Are you not active? So we kind of really go through all of those questions because again, in our office, we're really looking at you as a whole person, not just, hey, I'm coming in because I have neck pain. Can you, look at my neck and see? I'm like, well, it may not be specifically your neck where this issue arises, right? We have to look at you as a whole person and then decide what works best from you for care going forward.
That is such a great approach. I think with any provider, it's so important to look at the whole life, not just get them in and out the
Yes,
door. I love that that's
correct.
something that you preach, and you so do preach like a holistic lifestyle from beginning to end. And I
Yes,
totally agree with you. I used to wake up and I used to sleep next to my phone charging and, wake up, look at my screen, turn off my alarm, be on social media right away. And just the simple practice of like buying an old fashioned alarm clock. I actually have like a sunrise one. That's a whole other thing. It's over the top,
yeah,
but
yeah,
doing that, like not even having my phone for at least like 30 minutes to an hour, not even checking it, not looking at it, and just like doing my morning routine first has been
yes,
so game changing. I would have never guessed that it would make actually such an impact on how I feel. So
correct.
like the constant stimulation, I think you're so on the money there. We are so overstimulated. And people, I think people are realizing they're overstimulated. I'm hearing that word come up more and more. So that's a
Yes,
good thing.
yes. And I mean, it's hard though. It's a big transition because I think in today's society, it's people feel really isolated in it, which that's a conversation people talk about a lot, even though we're more connected than ever, the isolation is real. So if you're not checking your social media or, I don't know, turning on the TV, whatever you're doing, you feel left out or you're not included or you don't know what's going on. But I always encourage people, focus on what's in front of you. If you have a family, if you don't have a family, find something that brings you joy. If it's reading, if it means going outside and grounding and standing, letting the sunshine hit you. I know if you live in the Northwest, sometimes that's hard when it
True.
rains all the time. I've lived there for a long time. Or finding some type of routine, if it's a red light, again, we can talk about all that stuff. Red light, cold plunging, if that suits your nervous system. So there's lots of techniques that you can use, again, at the beginning, at the end of your day to help kind of guide where you're at individually. And I think that just most people know this. That's the funny part is like everyone knows what they should be doing for the most part, right? But it's actually putting that into action. I mean, I'm no angel too, right? I have days where I just, want to, after I work, I'm overstimulated. I'm talking to people all day. I just want to sit and do nothing. But even reminding myself, hey, maybe we should pick up a book. Maybe we should just go stand in front of the red light for a little bit, downregulate my nervous system, and, then start fresh the next day. So.
That is so good and so wise. Also, red light is becoming so wildly popular, but I think a lot of people don't actually understand what they're doing when they use it. Can you explain a little bit like how it works, what it does for you?
Yeah. So, I mean, I'm no I don't know. I mean, I know the basics of red light. Obviously, there's probably people way more informed than I am. So there's different types of red light too, and again, researching it and understanding it. And you can't just go straight into it too. You need to start at smaller dosages. But again, it can help with skin issues. It can again help with nervous system stimulation, even joints too. If you have inflammation in your joints, it can help with all of that stuff. Again, more or less just what I read. It's not my forte by any way, shape, or form. So I'm not going to take credit for knowing that much about it. But my big thing is it's almost like a relaxation technique. And again, it's helping decrease inflammation in your body and just again helping with that regulation of your nervous system.
I love that. Yeah, red light is amazing. I've been trying to be more like consistent with it, and it does make a
Yeah,
huge difference. Also for just like beauty and skin healing and all the
correct.
things, like love it. Okay, so shifting gears a little bit. So as
Yep.
I've obviously this is a overall wellness podcast, and as I'm kind of going through this and interviewing people, I'm also on my own, I call it soft biohacking journey, where it's essentially like I'm biohacking, but not to the extreme, just finding ways that are sustainable and getting back to being in touch with my body. And one thing I've really learned is historically, this field has been pretty dominated by men, and women have been following what the men recommend, which is kind of treating women like little men when our bodies are actually so different and our needs
Right.
to optimize our health. Like if we train and eat and act like a man and live on that 24-hour circadian cycle versus training, eating, and acting like a woman on that 28-day cycle, like it's going to make a huge difference. So as a chiropractor, like what are some of the differences you see between the men and women coming in as it pertains to like where they hold tension, maybe some of the postural distortions?
Yeah, so the big thing with that is, so I'm going to kind of backtrack a little bit. So again, like you were talking about with women, so understanding your cycle is a huge part of female health, right? And people don't really, I mean, I think it's becoming more to light at this point, but understanding the different parts of your cycle, foods you should be eating, how you should be working out, when you should, consider resting more. But obviously, men have different levels of hormones too, and they're not going through this. But in terms of actual spinal health and what we see in the office, where men and women hold stress and tension and distortional patterns, it can be actually pretty similar, which is interesting. But the big thing, again, that we really focus on is cervical curvature, right? Because that's the dominant powerhouse. People don't realize that the base of the occiput up in C1 up here, that's where, like, the dural attachment site is what it's called. So that high nervous system environment. So when you lack that cervical curvature, you're putting your body in a compromised state. So men and women alike, it's actually pretty similar because we're seeing that people are losing their cervical curvatures very early on. And we're seeing that even in adolescence, okay? And it's going to become a problem. It already is a problem, but it's becoming a bigger problem because it is, again, you're directly affecting posture, you're affecting how that brain's communicating with the body, and then systemically, men and women just will show necessarily different symptoms, right? With women, it could be infertility, it could be, irregular periods and other things like that. A lot of depression and anxiety in women, we're seeing that a ton. I can't even tell you, 80 to 90% of people we see, they're on some type of antidepressant, and it's devastating. And I don't think that's talked about enough either.
Mhm.
And men, right, they put on their hard hats. They're like, oh, I'm okay. Like, no big deal. But once you really start pulling stuff out with them, right, they're stressed out. They have more pain than they lead on. And, you're seeing even like erectile dysfunction, as I guess is an example too, that, people don't correlate with that or stress, or even you're starting to see cardiac issues, again, hormonal issues. So they're kind of, back to the main point of the question, they're pretty similar in the sense of what we're focusing on because those are the main posture points that directly correlate to that nervous system sympathetic, parasympathetic tone that we're trying to regulate.
Wow, I actually find that so, I mean, morbidly fascinating that our fertility, which people think of as, down here,
Right.
is affected by what's going on up here in the neck. And same with like
Yes.
erectile function. All like that is so crazy. And I hope that one takeaway people can receive from this is how connected the body is. We're not looking at
Right.
nothing's disconnected. The body is one whole functioning,
Correct.
communicating unit. So I think some of the answers are probably going to be obvious, but what are some of the reasons why we're seeing so much of that curvature in the neck going away lately?
So, I mean, again, this can start in utero. So, people that don't know, we actually specialize a lot in pediatric chiropractic care. So, when you're pregnant, right, and you're developing your baby, how you give birth, obviously this, I don't want this to say there's a right way or a wrong way, but the big thing is vaginal delivery is extremely important for the development of the baby. Okay, if it's a C-section, obviously there's reasons that that's necessary. I don't want to shame anybody for having that happen, because obviously the safety of you and your child is the most important thing. But by not being birthed vaginally, you're not getting that vaginal like pumping mechanism, which is really important for fetal development when you start shifting all these cranial bones and getting that CSF flow initially as a baby, right? So this is kind of the foundation, right? If you come out and you already have rotational issues in the cranium, in the upper cervical, in the sacrum, which is the lower triangular part of your low back, you're already setting yourself up technically for failure going on, because you're going to be generating abnormal curvatures. Most likely you're going to have asymmetric muscle formation, right? So as you start doing tummy time, people talk about all the time, tummy time, tummy time. It's so important as an infant. If your baby is not doing tummy time, right, they're not going to be getting that proper flexion and extension in the neck and an extension in the low back to create those curvatures. And then if you have neurotension too, they're not going to be want to do, they're going to get fussy. We see something called plagiocephaly, flattening of the head. We have breastfeeding issues. Again, that's a whole nother topic, but it starts from the womb and how they're being birthed. And then now, as a society, again, we're on technology all the time. People want to be on tablets, they're on little video games. Kids aren't outside playing. They're stuck in this anterior dominant. Adults alike, work from home is a big thing now, as we're sitting here on computers too. Like, naturally, unless you're very in tune with how you're sitting, people will naturally anterior roll in. So then you're already affecting these curves. And it's this continuous battle unless you're very intentional about it and working towards it. We're getting it's really bad what we're seeing, and it's just getting worse, and people are running into all these other health issues. And then add in the other component, drinking water, the foods we're eating, they're all toxins that we're absorbing, and it's creating subluxation patterns, which also indirectly is affecting spinal curvatures too, because it's creating tension and it's creating that muscle imbalance. So again, it's really not a one quick answer. There's lots of factors. People ask, well, how did I get this way? I'm like, well, do you really want me to go down this path?
Yeah.
Because it starts from the beginning, and how you are as a baby and an infant, and what your parents are doing to kind of establish that foundation for you.
Okay, so that's so fascinating that it really does start with birth. I think the technology and the phones and all of that are a pretty obvious answer when it comes to
Right.
the neck hump, the hunching, but a lot of people don't think about how they're born. And I know you do a lot of work when it comes to pregnancy, birth, and postpartum care, both for mama and for baby. And I would love to get into that, but like to start,
Yep.
what I recently was learning that how somebody is born can actually contribute to a lot of trauma, mental health, all these things. Like when they're adults, some of their tendencies can have to do with birth. Do you have any like insight on kind of that whole trajectory?
Yeah, I mean, I don't know scientifically any research supporting that personally. I'm sure, there's people that childhood development specialists that know how to answer that better. But I think, indirectly, again, it's like that, the way that you're wired, right? So how you're brought in, if it's a stressful environment, not stressful environment, I think that's a big factor, right? Home birth versus hospital birth. Again, interventions or no interventions. This is a soft, smooth transition. Are you able to have that connection with mom right away, right? Like, can you lay on her chest, like that golden hour? So that's a
Mhm.
big component of it. But when it comes to specifics, I don't really have a lot of information on that. I just know what I see, and I definitely think that there is a factor behind that, 100%.
Yeah, it's so fascinating. For everyone listening, if you hear little barks in the background, that is Miss Kemper, the mascot of this podcast. So give her grace. So okay, so then kind of going into that, I know that you've worked with a lot of mamas to be and just been part of the development care for pregnancy and beyond. So why would somebody who is pregnant want to receive chiropractic care?
Okay, so with that, Again, lots of reasons, but the big thing for me is prepping the body for labor and delivery. So I'm going to kind of explain what we do. So it's called Webster technique is the main technique that we use for pregnant moms. So we're focusing kind of on three main components. You have a bone, you have a muscle, and you have a ligament. So on the front side, we have that pubic bone, we have that round ligament, and then we have something called the psoas muscle. So again, the ultimate point of doing this is to really open up the pelvis and create proper fluid biomechanic movement between the sacrum and the pelvis. So we're getting that movement because you want it to expand, you want it to be able to internally, externally rotate. So as the baby descends in even positions as they develop, that they can be in optimal birthing position, head down. And that way we're helping improve labor times, labor pains. It helps with postpartum recovery. We're helping, again, creating that happy homeostatic environment for mom and baby so they don't feel that fight or flight stress from the mom as well. I'm going to go back really quickly. So with Webster technique, that was the front side. On the back side, we're focusing on what's called the sacrum, the piriformis muscle. So a lot of times women, they explain that they're experiencing sciatic leg pain. So we're trying to make sure that that muscle is not spasming, creating that like shock-like effect down their leg. And then there's also a little ligament at the base of the sacrum called the sacrotuberous ligament that we're trying to relax that can inhibit that proper movement mobility of the sacrum. And again, also influencing that nervous system. So that's like the main gist of working on pelvic biomechanics. But again, full spinal treatment is still going to be lucrative because the powerhouse of a lot of your nervous system sits at the base of your skull. So we're still wanting to focus on that area. But again, setting yourself up and your baby up for success early on, I always recommend starting. We see a lot of women even preconception, but making sure that you're continuing to support your body and your developing baby is extremely important. And we see really great benefits with that.
That's amazing. Yeah, I've heard really good things from friends who have personally gone through chiropractic care, like worked with a chiropractor and a midwife through their pregnancy, and how their births were so much better and more empowering
Right.
and faster. And I love that concept. One thing I've gotten really interested in is realizing how often we as a society have accepted certain things of life, whether it's periods, pregnancy, and beyond, just not feeling good, like feeling awful and being like, well,
Right.
that's just how it is. But the more I
Yes.
get curious, the more I'm like, well, we weren't meant to feel horrible all the time.
No.
People have been having periods, people have been giving birth since the beginning of humanity. So how can we get
Correct.
back to it being how it's meant to be? And I think that's been the question that I've been really, really curious about.
Well, and I think just, when we talk about actual birthing, and that's why I love them. I'll preach the midwifery model until the day I die because I just think it's just incredible. Those women and men, mostly see women, but they're just godsends of people and they trust the body. They trust that, that's why we were created as women, right? We were meant to recreate, we were meant to have babies. That's why we were put on this earth. So trusting, the intelligence of our body and our God-given potential to birth humans is amazing. And, I don't want to pull religion too much into this because obviously everybody has their own stance on things, but I definitely think that, we were designed perfectly. And when you start to bring in different things, we're creating a foundation for failure. So we try to hone in what, again, our natural abilities are and just stick to that.
I love that so much. And yeah, you obviously know I'm a Christian. While, this is ultimately a wellness podcast, we are very friendly to Christianity and that being kind of a foundation for our philosophies in wellness. So
Yes.
that's something I totally resonate with. I think that
Yes.
oftentimes when we go back to how we were designed, that's when we start to feel more harmonized and more at peace
Correct.
and things start to feel better. Right now, we have so much noise and so many people telling us this is the way we're supposed to give birth. This is the way we're supposed to menstruate. This is the way we're supposed to operate. And a lot of those systems are not set up for our success. So it's
Correct.
when getting back to nature is just so phenomenal. Okay, so kind of moving forward. So pregnant mama, she's getting her care. She's working with a midwife as well, gives birth. What happens next for mama and for baby as far as the chiropractic care goes?
Yeah, so I kind of leave it open-ended for our patients in our office. Obviously, I recommend as soon as you feel comfortable to come in and see me because, especially for a baby, the sooner they get that first specific neurologic adjustment, it's going to be very powerful for their, breastfeeding journey, just for their ability to relax. Because again, they're scrunched in this tiny little ball, regardless of how they're born, cesarean or vaginal, they're going to have some type of dysfunction going on cranially. I don't want people to think, oh my gosh, my baby, baby have cone heads all the time or different shapes too. Naturally, the body does know how to correct a lot of things. Usually that 6 to 8 week mark is where we see the cranium starting to settle, I guess is the best word to call it. But we want to make sure it's settling appropriately, right? Because again, it affects everything. You have all those cranial nerves that come through that affects latch and all that stuff. Again, if you choose to breastfeed or not, breastfeeding again is a topic that's very near and dear to my heart also. But we want to make sure that they are set up foundationally. So sometimes that means, like, if you're a current patient in our office, what we always do is sometimes we'll come to your house too, because it's important to me. Hey, I want them to be adjusted within the first 48 hours of being earthside. And some people, they have a more traumatic birth, or we don't see them and they wait longer to bring their babies in. But I always say, start them soon. We can prevent symptoms from even arising, right? Don't come see me when your baby's already colicky and all this stuff. Obviously, I would love that because my goal is to help you. But we can literally prevent these things from even coming about, so we don't even have to deal with them at all. So that's always my number one advice is, if your baby looks perfect and beautiful, which they are, still bring them in, because my goal is to make sure that they don't have these issues going forward. No constipation issues, no sleeping issues, reflux. I mean, the list can kind of honestly go on, but that's kind of my big thing. Mom in general, usually about the same thing. I can adjust them, especially, trust me, after giving birth, you're going to want to get adjusted. I'm spoiled because I'm married to a chiropractor, so I got adjusted within a couple hours of giving birth. But that's probably the most Hail Mary adjustment ever, because you're just like, oh, I just worked so hard. I feel so much better. But sooner the better is what I recommend always.
Wow. Okay. So when I get pregnant, I'm flying you out and you are going to be my chiropractor
Love
because
to.
that sounds amazing. Yeah. And I obviously fully believe in it. I love chiropractic work and I fully believe that it can help a baby, especially because of all the crazy things happening, all the things moving around for mom and for baby. And I love that you're part of the journey for both. And the best care is preventative. I mean, if we can prevent disease or symptoms from arising, how much better is that than managing already existing symptoms and issues? So I know that one issue a lot of moms have, a lot of new moms, as I'm seeing a lot of women around me starting to start that season of life, is like the fear of baby's immunity, of getting sick. How can chiropractic care early on impact the baby's immune support?
So again, breastfeeding, I'm gonna hit that.
Yeah.
I don't want people to get upset by me saying this, but breastfeeding is still the best thing you can possibly do for your baby. Obviously, fed is best. I understand that, but breast milk, it has all the properties that your baby needs to really start developing that immune function. Okay. There is nothing you can inject or put into your baby that is more powerful than breast milk. Okay. That's my
Love
opinion, but
that.
also scientific fact. And if anyone tries to combat that, I'm like, okay, it's just true. I'm not trying to hurt people's feelings, but breast milk is best. That has the best stuff. It changes properties as your baby develops. If they get anything, it'll change to support their immune system. But when it comes to adjusting, again, we go back to that neuroregulation. So sympathetic versus parasympathetic state. When your baby is in a sympathetic dominant state, or they have subluxations in the upper cervical spine or in the sacrum, it kind of lowers your immune response, right? It's like anything. When you're stressed out all the time, the likelihood of you getting sick is extremely high, right? Because your body isn't relaxed. It doesn't know how to fight off antigens and all that kind of stuff. So it's the same case for babies. So supporting their nervous system so that they can downregulate and that they can be in that rest and digest environment is going to be really important. So from an adjustment standpoint, again, making sure they do not have those subluxation complexes. They don't have those cranial disturbances that's going to affect the way that their body's supposed to be functioning when they're introduced to new environmental pathogens and just pathogens in general. That's going to be really important. And that's where we can also come into that conversation about vaccinations. And, I don't want to ruffle feathers on that too, but that is
You can
also a
ruffle
really
feathers. It's okay.
big topic, right? Kind of pharmaceutical companies, right? They're the dominators of our country. Okay, they pretty much control government. They control everything we do. as much as people like to deny that, it's 100% true. Follow the money. That's just where it's at. So when babies are born, home birth, hospital birth, again, that's kind of another avenue again. But most of the time, if you're having a hospital birth, Big Pharma is in your house within hours of your baby being born. Your baby is getting injected with vitamin K, hepatitis B, and they're getting the erythromycin ointment on their eyes. Okay? I don't think a lot of that stuff's necessary. Okay? But that's the start of it, right? As soon as you inject that stuff or put that stuff into your baby's body, you're already disturbing their innate godly design that they were given. Okay? And it's already starting to transition what life looks like for them. And now you're in that model, right? They're not capable of making their own decisions. So as a parent, it's a really hard decision. I understand it's conflicting, but understanding what you're starting and understanding the repercussions of that is really, really huge.
Fully agree. And yeah, just a reminder to everyone listening, like whether or not you are pro or against vaccinating your baby, I just want to encourage you to listen to this with an open mind, because ultimately hearing things from all angles and hearing a different side of things than what we've been told in schools and by doctors and everything growing up, I think is a really healthy thing. And ultimately, you have to remember that, pharmaceuticals are really the only industry in the US that have that criminal like invincibility. Like if you
Right.
can't sue a vaccine company or pharmaceutical company if you die from a vaccine, like you can't sue them. So I think the fact
Right.
that that is in place is pretty crazy.
It's a red
Um,
flag. Yeah.
Very big red flag. I think that if you trust your product, you hold accountability for yourself and for your product. I know that that's why companies have great return policies, because they trust their product. So
Right.
if you can't have that accountability, I think that is kind of spooky personally. So I think, yeah,
Yeah,
we are
100%.
definitely in the same thing there. And you become a customer for life. And that's a scary thing. Once you start relying on these things for your health, quote unquote health, you become a customer for life. I know even for me in the past few years, I've gotten way more investigative and curious about how I can heal naturally. And finally, this year, I'm completely pharmaceutical free in every capacity. And I've never felt
Amazing.
so good. And the big one was healing my thyroid. And so working with a naturopath on how to heal my thyroid naturally. I trashed it with veganism for 5 years. And it's been taking years to heal, but I was on synthetic thyroid for years. And now being just on a natural regimen, I can tell you that the physical difference every day is astounding. It's not just like a mental thing, like
Incredible.
it's incredible. So I fully am with you there. And
Yeah.
I fully agree with it. And I love that you guys are kind of helping with the breastfeeding, the immunity, all these different aspects of it. And I know obviously you don't we all agree that fed is better than not fed, but with that being said,
100%.
what are some of the concerns that you have with like the ingredient list in the formulas that we're seeing out there today?
There's just a lot of additives. It's synthetic, right? It's not something that the bodies are meant to digest and break down. I will say, though, I'll give a lot of credit to the companies that are trying, right? Because in reality, some women, they really struggle to produce breast milk, right? Or they can't, or let's use adoption, or there's lots of reasonings why you can't breastfeed, okay? And there's a lot of good European companies in particular are typically shown to be better because they don't allow a lot of those ingredients. So again, if that's something that you can't do, you choose not to do for whatever reason, there are options out there. But again, the problem is we're seeing most mainstream pediatricians, again, these companies, they give these pediatricians samples, right? So when or in the hospital, they're like, oh, your baby's not latching, like they're fussy because they're hungry. They're instantly giving these mothers and dads Similac, all this stuff that has all this junk in it. And I'm like, okay, the first things you're feeding them are literally chemicals. I'm like, no wonder your baby's getting a rash. No wonder they're screaming their head off. No wonder they don't want to latch, because you're giving them this nipple that's resembles nothing an actual nipple. It's again, it's sad. I think it's sad, and I feel for moms that can't breastfeed or can't produce milk, because that is a real thing, right? So we need to have options for these people that they can have. But also that goes back to donor milk too. Our community down here is incredible. If you have extra milk, it's being donated. We have our midwives, they have banks of milk that they can give until you can get your milk supply up. And I think that's something that's underutilized. And a lot of people put shame on that. Like, oh, you should not be feeding your baby someone else's breast milk. Like, you don't know what's in there. And I'm like, but do you know what's in the formula you're feeding your baby? Like, I would much rather give donated breast milk. And people are transparent, right? Like, are you taking any medication? What does your diet look like? I mean, as long as you have a trusted community and you know the person you're getting it from, I think it's a way better alternative. But I think that's something that people are striving to do, is to make better and safer formula for babies, because it is something that's needed, and it's a reason a lot of babies stay alive too, because hunger is a real thing. So I don't want to discount that by any means, but I think we need to do better with anything. Do better for our kids and for the future of our planet.
Of course, yeah, and leave it to Europe to have the better formula options. I'm not even surprised at this point. I mean, the stuff we
Yes.
allow in the US is insanity. Okay, so for locally, but in general as well, let's say somebody is having a hard time producing breast milk, or they adopted,
Yes.
or for whatever reason they can't and they want to go the donor route. How would somebody go about finding donor milk?
So it kind of depends on your community. I always recommend, I mean, I say chiropractors because chiropractors just, especially like pediatric, prenatal ones, most of the time they have their network of people of lactation consultants. Lactation consultants are literally angels. They teach you how to do everything, help you with everything, help with baby you. Lactation, I'm gonna totally butcher this because I don't even know I think it's still a thing, like it's called La Leche League. There's different organizations and companies that you can meet. Facebook groups are great. Local midwives. I want to say local OBGYN offices. I personally can't say I know anybody that helps coordinate that. But even just finding moms groups, right? Finding people that align with your values. And most of the time, you're going to find people that have an oversupply, or they know somebody that has donor milk that they can give you.
That is so amazing. I love that this is a thing. Like, that is the true definition of women supporting women. And
Yep. Takes a
just it,
village.
yeah, it takes a village. I love that. And if you are somebody who is breastfeeding and you have an oversupply, like, let this be an encouragement to be a donor, because you never know
Yes.
whose life you might impact. I think, whether you're on one end of it or the other, I hope that you can be inspired to either reach out and look for that, or to become a donor yourself. I know that if someday I'm blessed with an extra supply, after hearing what you have to say, that's something that I would definitely want to explore and try to do, because that is such a beautiful thing for women, to be able to help other women and other families thrive and just be healthy. So that's
Yes.
beautiful.
Yes.
Okay.
It's really great.
I love that. Okay, so shifting gears a little bit, I do want
Yep.
people to have some tools to take home after listening to this episode, and we're going to get into a little bit of Q&A later as well. But
Okay.
I would love to know, so outside of chiropractic care, which obviously is like something that everybody should be curious about, looking for a good chiropractor,
Right.
what are some at-home things that people can do to improve their spinal health, their posture in general?
I mean, I think it literally starts with just moving your body, right? Not having a sedentary lifestyle, creating mobility and range of motion through your spine is lucrative. And, it's obviously not a one size fits all. It can be foundationally move your body, walk. Walking is a great form of exercise. A lot of people will joke, oh, that's for old people. I'm like, no, walking is great for everybody, okay? Creating a good stretching routine. And I say mobility, it's kind of hard to explain via a podcast, but creating that motion through your spine, especially the middle of your back, it's called your thoracic spine, to help with curvature. The big thing is just stretching your neck, working on strengthening and stretching what's called the front side of your neck, anterior flexors. Again, I think and then again, we're going to go back to food and all that stuff too, making sure you're nourishing your body appropriately too. You're not putting in preservatives, you're not putting in chemically based food. Obviously, no one's perfect. Okay, I understand that, but the 80/20 rule, I think that's something that will just forever go on as something that's great, right? Like, do the best that you can most of the time. Obviously, there's wiggle room. I want you to live your life, not in a box. But I think that's the foundation, right? Nourish your body, drink water, move. I mean, I really think it's as simple as that, wholeheartedly, and try to find ways to eliminate stress.
I love that. Yeah, movement's so important. Like that mobility is just major. I've been working on trying to do my posture exercises every day, using
Yeah,
my dinner roll for my neck, all these things. And
love
the
it.
difference is astounding. I mean, it truly does make a difference, even as somebody who's very active, just taking time to like open things up, move my neck, all of those things really can help with pain management, with stress, all these
Correct.
different things. So then with that, I think a lot of people do feel like they have a lot of inflammation in their body, whether they lift or whether they're eating a certain diet or stress. I know for me, when I lift a lot, I feel inflamed in my back and in my traps. So what would you recommend food wise for people who are working on getting inflammation down so that they can ultimately heal?
Again, whole foods, right? Whole foods, protein is the big one. Um, that's always my number one advice. Obviously, knowing like your weight, what you should be eating, right? Making sure you're eating enough calories and fluid consumption. People don't drink enough water. And then if you're drinking water, making sure you're putting some type of electrolytes in there. It can even be Celtic sea salt. Taking a little pinch of Celtic sea salt, dribble it in your water, making sure you're actually absorbing it and not just paying it out, which a lot of people do, and making sure you're getting good quality water. My husband, I'm totally going to butcher this. He just read in Arizona, we have probably some of the worst water quality known to mankind down here. If you don't have a full house system, it is not good. And your body is going to be rid of inflammation. So it's just being aware of those simple things too. And, supplements is also another conversation. I think again, that is dependent on the person. And also, I would always recommend somebody working with a naturopath and understanding supplements because I think people just aimlessly will take supplements just because they see it on social media or it's advertised to them. It's like just because you see it doesn't mean you need it. Like, you know what I mean? And, but again, foundational stuff, hydrate, make sure you're eating a whole food diet, make sure you're recovering too. Because I think people go too hard in the paint, right? They're trying to lift heavier. It's not necessarily about the heavier weight, right? It's about the proper range of motion while you're lifting. And obviously you're going to incrementally try to get better, but don't feel like you have to be going so hard all the time. So again, I know that's a loaded answer, but it's not really a one size fits all, but inflammation attacks people differently and kind of again, just focusing on rest and recovery and nourishing and fueling your body appropriately is probably the number one thing.
I love that. Yeah, and even one of the paramount fundamental like concepts in biohacking is recovery.
Correct.
Recovery, sleep, reducing inflammation, so important, so underutilized. I know even for me, like scaling back and cycle syncing my workouts, not lifting on my period, all those things
Right.
has actually made a huge impact where I think a lot of women have this, they're driven by society to feel the need to work so hard every day to eat fewer and fewer calories, and
Right.
their bodies are adapting to function off of less energy and to be less optimal, and we're unable to recover, so we're in this fight or flight when really like we need to nourish our bodies, eat more protein, more collagen, healthy
Right.
fats, take time to recover. And honestly, women, if weight loss is one of your goals, being able to optimize recovery and eat enough of the right foods will actually help you lose weight, not gain weight. And I think that is like the biggest paradigm shift that so many women need to
Right.
understand today. It's
100%. Well, and
so
that's where,
shocking.
where I kind of mentioned, again, Ozempic. I get there's again time and a place for it. Okay. Some people just need that little kickstart, especially if you're obese or you're having other, health problems and we need to get that weight off quickly. But again, it's attacking parts of your hunger system that are turning off these signals. So people essentially are starving themselves and they're still not getting the appropriate nutrition. So even though you look better, you're basically still creating a lot of problems inside internally. So it's just again, time and a place like everything, right? But just again, it's really is, I hate to say it, but it's simple, right? Relaxation, rest, whole foods, water, taking care of your nervous system. And again, that's where we pull chiropractic back in too, regardless of symptoms or not, making sure that your spine integrity is there and that you're creating that space for your body and your brain and body to communicate so that your body can function appropriately. Because again, your spinal cord, your spine is the foundation to all life, right? If you didn't have it, you would not be alive. So take care of it. You're not going to get another one. You can't have a spinal replacement.
Absolutely. Yeah. Take care of it while you can. Take care of it young. Don't wait for
Hmm.
symptoms to come up in order to
Correct.
get care. preventative care is the best thing. Okay, so I did ask the audience for some questions for you,
Yeah,
and we have some questions, so I'm excited. So
perfect.
if you did ask a question for Dr. Stephanie Benz, this would be the time to make sure you're listening and taking your notes. Number one question is, how do you make adjustments last longer at home?
So this is a loaded question too, because I think that this is the problem with, I think, chiropractors now, because people have the assumption once you go, you always need to go. That's not the case. But the big thing is a lot of times people aren't doing a thorough enough evaluation. So when it comes to true spinal correction, you have to look at x-rays. Okay, this is the game plan. We need to actually fix the curvature. Okay. So people that like, oh, I'm going back all the time, or I feel better for, I don't know, a week and then I feel the same. The problem probably is you're not truly correcting your problem. You're kind of just slapping on a band-aid. Oh, you feel good tentatively. It's like getting a massage. I love massage therapists. I think they're wonderful. But like if you do it once a year, it's not going to fix your problem, right? So going in and doing an actual care plan, fixing the problem of where it underlies, and then maintaining it so you're not having to go all the time. That's my answer. I just think that people assume they need to go once in a while. I'm like, but that's, again, you can't work out 2 or 3 times and expect to be fit. Or let's say you get fit and you have your 8 pack and you're like, oh, I'm fit. I'm not going to stop. You're not going to stop going to the gym. You're not going to stop eating healthy. It's the same concept. So once you get to that point of true correction and true healing, then we can maintain it and you don't have to go and you won't even need to go as often because your body will know how to self regulate and correct those things naturally because you're in an optimal position.
Amazing. Yeah, like actually fixing the problem versus, yeah, because when you walk
Yes.
out of the chiropractor, you feel like pretty good. And then
Yes.
sometimes I feel like it takes one misstep and all of a sudden I'm like, oh yeah, like I can feel that tension's coming back. So that probably does mean
Correct.
it was never fully healed. It was just kind of like we were on our way there. But
Yeah,
that
yep.
makes a
And
lot of
again,
sense.
it's again, it's kind of a multifaceted approach, right? Like with anything, obviously this is a foundational thing. There's still everything else in your life that you need to work on. Like we can't fix all your problems. That's always my thing. Like my goal is to fix the foundation and get you there. But if you want true healing, true health, like you have to focus on the whole picture, right? Because in chiropractic we talk about the triad, right? Thoughts, so it's basically it's physical, it's mental, and it's emotional, right? Even chemical, right? There's all these factors that contribute to health. So we're just a component of it, the foundational component. And if nothing else is changing, then you're just kind of beating a dead horse, truthfully.
That's so true. Yeah, like how you're operating in your day to day and taking care of yourself is a huge part of it, for
Right.
sure. Okay, so next question. What are your thoughts on cupping therapy?
I love cupping. I think it's wonderful. I think it's a great addition to chiropractic. Same with acupuncture, right? So cupping is a really good way to. I mean, there's different types of cupping. Again, I am not a specialist in cupping, so I apologize to anybody that's listening, and I could butcher this. But there's like heat cupping too, where you put fire underneath and it pulls up. There's just the suction cup. But it's a great way to help decrease stress, bring blood flow to the area. I think it's a great added therapy for sure.
Amazing. Yeah, I love cupping so much for
Yeah, it's
tension.
incredible. No, it's amazing. Yeah, I love it too.
It's so good. I've even started doing facial cupping, which is more lymphatic drainage. You're not using intense cups, right? But love it. Great for
Correct.
recovery.
Yes.
And then this might be a loaded question, but let's
Yes.
say somebody has a back that cracks all the time when they move. Like, why might they be popping and cracking so much?
Again, it kind of depends on the person until you kind of do a full evaluation. It's hard to know. But a lot of times, too, we see that also because people are just self manipulators, right? So you kind of are creating a hypermobile joint. So naturally, when you're moving, you're just going to cavitate, which is that popping noise is just the release of gas. So just by moving, again, people don't really realize they're doing, I'm sitting on a chair right now, they're leaning back or they're bending left, right? Or they're twisting and they're forcing that end range more than they should. So again, you're creating that almost hypermobility. So naturally your body will release more. So I don't like to say it's necessarily a bad or a good thing, but if you do it too much, you're going to create an issue in your spine. It's going to create tension patterns that you don't want. So if you're a self-adjuster, please stop.
Go see an expert. Go see a
Yeah, don't
chiropractor.
don't do it. But no, I mean some people just naturally click more. It's not concerning to me, but just don't. I just say don't keep trying to click because sometimes like, oh, it's tight. Let's do this. I mean, I do it too, but you could be shearing the joint in the wrong way, and it could eventually create more problems. But the actual itself of just clicking, like if you're just naturally moving, oh, it just popped. It's mostly harmful, or I mean harmless. Sorry.
That's really good to know I can get stressed. I was a dancer for 15 years, so I grew up hypermobile.
Yeah.
And there's a lot of things that sometimes click and pop as I move. And I mean, there are a lot of things like that have gone
Yeah.
wrong with my body because of being a dancer for 15 years. But
Yeah.
that's a real thing. And so I was like, oh, that's actually a really interesting question. I know that I experience a lot of like popping in the day to
Yeah.
day, but when I'm good
Yeah.
about my adjustments, I don't pop as much. I've noticed I've kind of fallen
Right.
off the wagon with like being as good about being in the chiropractor office all the time. But when
Yeah.
I'm actually on my regimen, I've noticed I am popping less. So I'm like,
Right.
huh,
And like
okay.
that, again, that self-clicking too. I mean, the body is an intelligent being, right? Your body's going to do what it needs to do to try to stay in optimal health, right? So a lot of times when you click too, that maybe your body like, oh, like I feel like I'm putting too much tension. I'm just going to release to prevent this. So again, it's kind of a natural response of you trying to self-regulate. If it's, positive or negative, it's hard to really tell. It depends on the person. But again, naturally, some popping is a pretty normal variation of just moving. But again, if you're intentionally creating the popping, don't do it.
That's really good to know. And hopefully that way, if somebody like stands up and something pops or whatever, it will like mitigate some of that fear. Cause I know I can get afraid of like, I'm like, oh my gosh, I'm getting old. Something's popping. So that's really good to know. Okay. So something I ask all of the people I interview, because this is a wellness podcast and I love to investigate and hear from the experts on what is going on in their lives as far as their wellness routine. What are your current health goals and what are some of the steps that you're taking to accomplish them in your own life?
Yes. So I have two little kids, and obviously, being a business owner, I try to practice what I preach, right? So I joke, I'm a big Peloton fan. So I will say that. I have the tread, I have the bike. So that's my big thing is I love hiking too. So like hiking, so lifting weights, hiking, eating whole foods is a big thing for me. Obviously, I get adjusted 2 times a week, every week, but also I'm spoiled and I'm married to a chiropractor. So that's wonderful. Again, water is a huge thing, electrolytes all the time. I'm personally really working on, again, what we talked about, the beginning and the end of the day. I am not an angel at that. I need to get better because, again, you get teched out, you get overstimulated too. And I just, sometimes I just need to watch TV or scroll. And that's something I'm honing in and working on. But a big thing for me right now, I will say, is I'm working on my hormones. I just stopped breastfeeding my daughter. She's 2.5, not that long ago. So I'm trying to get that back in routine and get my body kind of back to where it needs to be. Postpartum, again, we could talk about that. That's a whole nother episode. But, I try to give myself grace all the time because, taking care of other people is also very draining too, right? Because you take on a lot of what they're dealing with. So between that, raising kids and volunteering in their classroom, running the household, I mean, I get it, guys. I do it all the time, day in, day out. So I think my takeaway is, just trying to find something that works for you. Again, we have that red light. We have a cold plunge. I'm not a cold plunger. I'm just going to throw that out there. I think it puts me in fight or flight. So, again, finding what works for you. And every day I'm trying to navigate my body. And I think every phase of your life brings something different, right? What worked for me 10 years ago doesn't work for me now. So, and sometimes that's hard for me is okay, what made me feel good and what worked for my body when I was in college does not work now. So finding what works for you and how you can regulate your nervous system and get your body to the optimal health is, I think, just navigating that and finding the right support system to help you do that.
That is so good. Yeah, moms are truly superheroes, and balancing a business and being a mom has got to be just such a juggling act, and doing it with grace while taking care of yourself is so honorable. And I love that you're taking steps with all of the people you're pouring into in your life to make sure that you're pouring from a full cup and taking care of your health. I think it's so, so important for women to give themselves permission to still prioritize their health, and knowing that when you do that, you will be more energized and more equipped to do all the things in your life that you have to do. And yes, we have so many topics to discuss from postpartum. I already have a million other questions for you, so I would love to have you back on. I think
I would love
there's
to. I think this is great.
me too. Yeah, we'll definitely have you back on to talk about all things postpartum and pharmaceuticals and all of that fun stuff. But can you please let my audience know where they can find you, your practice, you on social media, all the things?
Yeah, so my husband and I own Culture Chiropractic. We are in Chandler, Arizona. We are really active on Instagram. It's just Culture Chiropractic if you want to give us a follow. Again, we try to post a lot of content and just try to engage our audience to just explain what we do, why we do it, and why we're so passionate about it. I mean, once you get to know us, you'll learn that we really practice what we preach, and we just love people and we love families, and we will literally do anything to get people healthier and just in tune with what's going on in our world. That's pretty much it. I say Instagram is the big way to reach us. Obviously, we have our website. Our website is culturechiropractic.com. Again, Chandler, Arizona. I'm Dr. Stephanie Benz. My husband is Dr. Ross Benz. We're a small family-owned business. We really want to keep it that way because we want people to be a part of our family, right? We want to take care of each other. We want to create that village that people feel supported and know that they're not alone in this journey called life.
I love that so much. And you guys, if you learned something from this episode or if you enjoyed it, please screenshot, whether on YouTube or wherever you're listening to your podcast, and give us a tag me, tag Dr. Steph Benz at Culture Chiropractic, and just give them a shout out because of all the amazing things they're doing so we can spread the word on spinal health and the importance of taking care of our posture from infancy, or really from utero to infancy and beyond. You guys, I hope you enjoyed this episode. And as always, you can always leave a review, leave a comment, reach out to me if you have any questions or any topics you'd like me to cover. I hope you have a wonderful rest of your day. Dr. Stephanie, thank you so much for joining us today. I really enjoyed this conversation.
Thank you so much for having me.